Today, I'm going to be unraveling the complexities of pain, helping you understand acute versus chronic pain, and also understanding the role of inflammation. Because if we understand inflammation, that's going to definitely help us in management strategies. As always, I will of course be going into further depth in other videos about these topics, but to give you the breakdown. Acute pain serves as an immediate alarm for our body, signaling harm or injury. This pain is often characterized as sharp and short-lived, and it's our body's way of protecting itself. Chronic pain, however, which I'm sure many of you are very familiar with, tends to linger for a while. And this form of pain extends beyond the typical healing process without any clear cause. It's kind of like that smoke detector that's always going off, even though there's no fire. This enduring pain can sometimes be caused by the nervous system's impairment. I mentioned this in a previous video, where the nervous system can sometimes become oversensitive to certain stimuli and often interpret normal signals as painful. So as you're all aware, pain is a feeling experienced by people of all ages and walks of life. However, as a general trend, my clients and my audience of 40 and older tend to be much more familiar with pain. Let's talk about some common experiences of pain for midlife and beyond. So these are going to be beyond the acute pain and more into the realm of chronic. As we navigate through midlife, our bodies may experience or encounter various pain conditions with increased frequency. This is not, however, directly linked to your chronological age. Instead, it's associated with being sedentary, deconditioned, and in truth, some degeneration that is caused by the aging process. So it's a bit more than the number of years you've been on this planet. What it comes down to is, what age do you feel? Some of these conditions are well known, including arthritis, fibromyalgia, back pain, and other neuropathic pain, which is pain related to an impairment in the nervous system's connections, or rather how the pain is interpreted. Let's touch on one common example, just to dive a little bit deeper into this subject: fibromyalgia. Fibromyalgia is a chronic condition marked by widespread musculoskeletal pain. It's unfortunately often accompanied by fatigue, cognitive disturbances, and various somatic symptoms. Despite the absence of actual tissue inflammation, which I'll touch on next in just a second, fibro is considered a neurosensory disorder, meaning there's an impaired ability to process pain signals within the brain. In this research citation, suggests that this inability or impairment to process the pain signal in the brain leads us to the understanding that fibro is a dysfunction in pain regulation, which the citation defines as a central sensitization syndrome. Say that 3 times fast. Central sensitization syndrome. Central sensitization. Who comes up with these? Fibromyalgia and the other pain conditions commonly experienced really underscore the need for a nuanced and personalized approach to managing pain. Now let's jump into the role of inflammation when it comes to pain. Before we go into this topic, let me clarify something. People use the terms swelling and inflammation interchangeably. They are the same thing, essentially. So in other words, if somebody says that something is swollen but not inflamed, that literally makes no sense. There are definitely different ways that the inflammatory process work, but in general, swelling is inflammation. If a client had that question, I would probably be a bit more open and understanding that, oh, you don't understand, that's okay. But this was a medical professional that was saying this. C's get degrees. Inflammation is the body's natural defense against injury or infection. Yet when inflammation becomes chronic, it can perpetuate pain, leading to conditions such as arthritis, for example. Going off of that example, rheumatic diseases are marked by chronic inflammation and persistent pain. This chronic inflammation basically sensitizes or makes really sensitive the pain receptors, which can lead to conditions such as hyperalgesia, which is literally hyper pain, too much pain sensitivity. Or can also lead to something called allodynia, which is literally just pain from a stimulus that doesn't normally evoke pain. And for those of you who don't know, a stimulus is not a check you get from the government. It's basically some external or environmental factor, which can include a pinch, that's a stimulus, just as an example, or a flick, that's a stimulus, anything that stimulates a response. Hope that helps. This sensitivity arises from changes in nociceptors within specifically affected structures. Remember, nociceptors are the pain receptors. Check out this video if you don't know what I'm talking about. Neuroimmune interactions, or the neurological, the brain component, the nervous system interacting with the immune system, particularly neurogenic inflammation, disrupts normal central nervous system signaling, contributing to increased pain sensitivity and secondary hyperalgesia, or pain sensitivity, outside of the affected area. Understanding these mechanisms is crucial for managing pain associated with rheumatic diseases. And just a side note, there will be more on this in a different video, but inflammation can be caused by sensitivity and, of course, allergies to food. Chronic inflammation can be caused by food sensitivities. I'll dive into a deeper video on this subject, but I can speak on behalf of myself that I did experience systemic inflammation from food sensitivities that went away when I stopped eating the foods that I shouldn't be having. More on this later. When it comes down to it, this persistent inflammation underscores the importance of not just addressing pain at the surface, but by understanding and treating the underlying cause, including if it has to do with your immune system. What I like to say to my clients is, if you have pain, don't cut the check engine light. Get it fixed. So there you have it. With this deeper understanding of the complexities of pain, understanding the difference between acute versus chronic versus how inflammation plays a role in pain, you are now equipped to better manage it. For links to the citations I've referenced in this video, please see below this video. You'll have access to that for a deeper dive. I hope you found this information empowering and useful. And if you did, drop a like and hit subscribe for more information for the future, and leave me a comment. Ask a question, anything. Share this video with anybody who you feel could benefit from it. And always remember, knowledge is power, and your health is an investment, not an expense. See you in the next one.